So today we are talking about meconium. Meconium is usually the first stool that is passed by a baby upon birth. Ideally, it should be passed after the baby has been born or once they are born. It's usually dark green, so it looks black to the eye, but it's dark green in color. As the baby continues to breastfeed and pass stool that contains breast milk, the stool will turn to green as it gets diluted and then later turn to yellow. So the baby's stool is usually yellow until they start feeding. When they start feeding on normal food, that is when now the stool starts getting the other colors that we see, like green, yellow, brown. But mostly the babies, as long as the baby is taking breast milk, the baby will pass yellow stool. So what happens is, this meconium is a product of many things. As the baby is inside the uterus, it will continue to swallow the fluid in the uterus. That's the amniotic fluid. And this amniotic fluid contains some hair and skin cells. Now we know that the first hairs that the baby has are called lanugo, and also the baby's skin will also peel inside the uterus. So these ones will be found in the amniotic fluid. So the baby is swallowing the amniotic fluid. Hairs and skin cells will be part of the meconium. Also inside the intestines, there are secretions like mucus. There is bile. So this will consist part of the meconium. Ideally, this meconium is usually sticky and a bit stretchy. Looks like tar on consistency. So once the baby is born, they pass it, and now they continue passing stool normal. But sometimes they may fail to pass stool. If they fail to pass stool, it may be because there's an obstruction. It's too thick, so it's not able to move, or the baby has a problem with the intestinal system, which is making them not be able to push the stool out. So if they pass it before they are born, we usually say it's amniotic fluid that is stained with meconium. So we say meconium stained amniotic fluid. So when you are in labor, you may hear someone saying the baby has meconium, and then they grade it, maybe grade 1, grade 2, grade 3. Sometimes for the mother, we just tell them the baby has pooped. Why would a baby poop in the womb before they're born? Because we say that is not normal. So if they poop, it's usually a sign that they're not getting enough oxygen. So they are distressed, what we usually call fetal distress. So low oxygen levels that are going to the baby will cause the baby to poop. So when the baby poops inside the womb, it's a clear sign that the baby is probably distressed. That is just a very clear connection, though it's not always the case. Some other things can cause the baby to pass meconium, like infection. So it has to be diagnosed by a healthcare provider who is also going to relate it with how the labor has been progressing. So if the baby passes stool inside the womb, there is a risk, because one, meconium acts as a very good environment for growth of bacteria, and some research has also shown that meconium contains some bacteria in it. So it's a risk factor for development of infection inside the womb, and also it can cause infection to the baby. Another problem is when the meconium is, the contents of the intestines are not exposed to the baby's immune system. So if the baby breathes in that stool into their lungs, and maybe it gets into contact with some cells inside the lungs, the lining, it's going to cause a reaction in their lungs. And this reaction is going to cause swelling in those linings of the lungs, the airways, and also it's going to cause something we call a chemical pneumonia. Chemical pneumonia is because of the reaction of the body's immunity to the contents of that meconium. So the baby's immunity will react against the meconium, and that will cause a reaction in the lungs, and it will cause pneumonia, it will cause inflammation, it will cause problems with breathing. And also another thing that we need to understand is that all these are going to affect the exchange of oxygen inside the baby's lungs. Meconium being a thick content, sometimes going into the airways can cause can affect the exchange of oxygen, because it's going to like smear along the lining. So it's going to affect the functioning of the surfactant. Now, surfactant is a fluid that helps in lung expansion once the baby is born. So when they take their first breath, surfactant helps to keep the airways open and also the sacs, the air sacs open. So meconium affects the functioning of this surfactant. So it will cause the air sacs, the air sacs to collapse. It will also block the flow of oxygen because it's usually thick. So it will either block oxygen going in or oxygen coming out. So it causes something we call a respiratory distress syndrome. So what causes a baby to poop inside the womb is low oxygen levels. What causes oxygen levels to go low is because either the baby's placenta is not sufficient. There are things that can make the placenta not to be sufficient. For example, if you have high blood pressure, that will reduce blood flow to the baby, because that means the blood vessels are constricted. So the baby is not getting enough blood flow. If there is infection, that can also affect the placenta. If the placenta is too old, there are people who go beyond the 40 weeks gestation. And also, as we have said, infection can also cause. So sometimes you may not be 40 weeks, but you do a scan and they tell you the placenta is calcified. That means it is already getting affected and it's not getting enough blood flow. Another thing that we need to understand is that other things like diabetes can also affect blood flow to the baby. That is concerning the placenta. Some things like if you have uterine fibroids, it may affect the attachment of the placenta, and that can also cause reduced blood flow. Placental detachment. Sometimes there are things that can cause the placenta to come out of the lining and separate. So those are the things that can reduce oxygen flow to the baby. Cord problems can also reduce oxygen flow to the baby. For example, if a baby has a nuchal cord, that is a cord around their neck, or a cord that has a knot, or if the cord comes before the head, that one we call it a cord prolapse or a cord presentation. So when the baby is being pushed to come out, they press against the cord. So they are not getting that blood flow. So they'll get distress. Other things are like if you're having difficult labor, maybe a baby is bigger than the pelvis, or if you're having very fast contractions, maybe you got medications that are going to stimulate your contractions. Those are some of the things that will maybe cause distress to a baby. There are people who get precipitate labor. They go into the labor, and within maybe 1 hour, they are already dilated. They are moving from 0 to 5 centimeters. So very fast progress of labor can also cause distress to the baby. So for us to decide on how to approach this, first of all, what we need to understand is that fetal distress can cause meconium to be passed in the uterus. But the other problem is that if the distress continues, there is a risk that the baby will gasp inside your uterus. So they'll try to breathe in. And when they are trying to breathe in, what happens is they aspirate that meconium. The risk is if they are coming out and we quickly respond, it is a good thing. But if they are inside the uterus and the distress prolongs for long, then they are going to inhale that meconium and it will affect them. Some of them, they may die inside the uterus, or they die shortly after birth, or get prolonged stay in the NBU. So what we advise is, if you have reached your due date, you need to go to hospital and probably be advised. It's not very safe to continue with pregnancy past your due date for so long. We sometimes allow up to 10 days, but that is if the scan is okay and everything is okay. If your baby has reduced movements, you need to go to hospital urgently. And another thing is you need to go to hospital early in labor, even if you don't have complications, for proper monitoring. That is to avoid